In tonight's Health Edge, local doctors are using a new technique that takes a person's own blood to make a powerful healing tool. It's safe, it's easy, and in many cases, it can help a patient avoid surgery.
One more.
Jody Treeweiler loves her job as a fitness instructor. But last summer, she started having trouble making it through her classes. Pain in her ankle was interfering with her life and her ability to make a living.
I noticed in between teaching I was limping, so I was in a lot of pain and dealing with swelling.
Jody injured her ankle as a cheerleader in college and continued to re-injure it in the years since. So she went to see Providence podiatrist Dr. Harvey Lefkowitz.
Because I knew I wasn't going to be able to continue teaching if I didn't do something.
After ordering an MRI, he determined the tendon which glides behind her ankle bone was frayed a bit. It should glide smoothly in its sheath like this rope. Instead, it looked more like this rope, with rough edges and pieces coming off it. It was not likely to get better on its own.
The likely outcome would have been more fraying of the tendon, just like a rope becomes frayed, and eventually they tear.
Steroid injections have typically been used in cases like Jody's, but
when the tendon is frayed, you run the risk of actually rupturing the tendon when you give a steroid injection.
So Dr. Lefkowitz suggested a new treatment called platelet-rich plasma, which is being used to help heal tissue.
The tissue is harvested from patient's own blood.
The blood is put in a special centrifuge machine that helps to spin off the platelet cells,
which are rich in growth factors.
like Jody's, and for patients with heel pain.
These are patients who have failed some more traditional treatments like perhaps casting, immobilization.
Jody had the procedure done in August and took it easy for about 2 weeks. In 90% of cases, there is a cure with just one injection. Occasionally, 2 or 3 are needed. Jody can't believe the results.
It's nothing short of miraculous. I didn't expect results like this.
Sounds pretty amazing, huh? This technique has been used for some time in operating rooms for bone healing, but the equipment to make the platelet-rich plasma has become smaller and less expensive, so it can now be used in doctors' offices and clinics.